Hi, everyone, and welcome to episode 145 of the Speech Space podcast. As we head into September, I know that many of us are focused on the beginning of the new school year. I am sending you my very best wishes, and I hope that the back to school season is going well for all of you. September is also Childhood Cancer Awareness Month, and in this episode, we're going to be discussing what SLPs need to know about childhood cancer. For some of us, this may be a very tender topic, so I really encourage you to take care of yourself and turn the episode off if it feels like it might be too much right now. For others, this might be a fairly unfamiliar topic. I know it was for me, and I'm grateful for this opportunity to share what I've learned as I prepared for this episode. It's really an incredibly important and relevant topic for all SLPs, even those of us who don't work in medical settings. And actually, that reminds me of one more thing I wanted to mention before we really get into this topic. And I just want to be very transparent that this episode is meant to be a broad introduction, especially for school SLPs who may be less familiar with childhood cancer and want to learn more. It will not be a deep dive into specific types of cancers or treatments or anything like that today. This is also a heavy topic, whether or not we have a personal connection to it. Many of us were drawn to this field because we love kids, and the possibility of children suffering and potentially even dying is not an easy one to consider. So again, please do take care of yourself. Ultimately, I hope this episode will be empowering because SLPs can play such a vital role in supporting pediatric cancer patients. It's a huge privilege to be able to support children and families as they go through some of the most difficult experiences in their lives. As we get started, I also wanted to mention that this podcast is brought to you by the Digital SLP membership site, which features time-saving, interactive digital resources that are all teletherapy platform friendly. You can learn more by signing up for a free trial at thedigitalslp.com/digitalslp. Since this episode is meant to be introductory, let's start with some pediatric cancer basics. The good news is that overall, childhood cancer is relatively rare, but it's still the leading cause of disease-related death for children. And around the world, about 400,000 children and adolescents develop cancer each year. The most common types of pediatric cancers are leukemia, brain and spinal cord tumors, neuroblastoma, which is a cancer of the nerve tissue, and Wilms tumor, which is a cancer of the kidneys. One important difference between most childhood cancers and many cancers that are diagnosed in adulthood is that pediatric cancers usually are not connected to environmental or lifestyle factors. This means that childhood cancers aren't generally preventable, so early detection is especially critical. SLPs can play an important role with this detection because we generally see students regularly over a period of months or years, so we are especially likely to notice symptoms and changes that could indicate cancer. In terms of things to look for, they include things like persistent fatigue, slurred speech, difficulty concentrating, or changes in voice, swallowing, and energy levels. Of course, SLPs don't diagnose cancer, and we need to remember that there can be many different reasons for these types of symptoms. But anytime we notice changes in a student's physical health, especially when there's no obvious explanation, it's worth paying attention to. I know this can be a delicate balance because we don't want to cause unnecessary anxiety, and some of the families we work with might not have dependable access to healthcare resources. So if you work in a school setting, it could be helpful to consult with the school nurse to decide if a symptom is concerning. But ultimately, because early detection makes such a huge difference in terms of cancer treatment outcomes, I recommend erring on the side of caution and following up on any changes or symptoms that you notice. After a child has been diagnosed with cancer, there are several reasons why they might need to work with an SLP. Cancer can have a significant impact on communication, with some of the impact coming from the actual cancer symptoms and some of the impact coming from treatment side effects. These impacts could affect things like articulation, cognition, language, voice, and swallowing. So let's talk a little bit about each one, starting with articulation and intelligibility. There are many reasons why cancer and cancer treatment might impact a child's speech, including muscle weakness, effects from surgeries, fatigue from chemotherapy, or neurological damage from tumors and other factors. These factors can lead to the characteristics that we associate with dysarthria, like a general slurred speech quality along with reduced intelligibility. Because these changes are caused by underlying medical issues, the SLPs who work with pediatric cancer patients aren't usually focused on restoring full articulatory function, at least not while the cancer treatment is ongoing. Instead, there's an emphasis on compensatory strategies and possibly AAC. The research is pretty limited when it comes to additional treatment options for this population, but there is some evidence to suggest that programs like LSVT Loud can be useful for reducing frustration and increasing intelligibility. I'll make sure that I link to some articles for you in the show notes about that. Next, let's look at how childhood cancer could affect a student's language and cognition. Cognitive changes are common with pediatric cancer, especially when a child has a brain tumor or is going through chemotherapy. And of course, as we know, when thinking becomes more difficult, language becomes more difficult. So children who are going through cancer treatment may also be dealing with widespread challenges in both expressive and receptive language, as well as executive function. This could manifest in many different ways, from trouble with organizing language to word-finding deficits to problems with following directions. And unfortunately, these challenges can persist after the cancer treatment is finished, sometimes even for years. This means that even if we don't work in a medical setting, we could definitely end up doing language therapy with students and clients who had childhood cancer in the past. The intervention research in this area is also pretty limited, but treatment usually involves a combination of traditional language therapy as well as accommodations and compensatory strategies. In some cases, SLPs may actually evaluate a child's language skills before cancer treatment begins in order to get a baseline and to track changes over time throughout the treatment process. In addition to articulation and language, pediatric cancer and its treatments can also affect voice and swallowing. This could be due to fatigue, muscle weakness, intubation, or other factors, and treatment usually involves compensatory strategies, vocal hygiene strategies, and diet changes, often in consultation with an ENT. There's one more important area of communication where childhood cancer can have a significant impact, and that's hearing. Hearing loss is a very common side effect of cancer treatment because one of the most effective chemotherapy drugs is also highly ototoxic. The drug is called cisplatin, and its ototoxic effects can be especially severe with pediatric patients. But because it does such a good job of treating certain types of tumors, it really isn't an option to just switch and use a different medication. Fortunately, a few years ago, the FDA approved the use of a drug to protect against hearing loss from cisplatin. It doesn't always work, but this is still a huge step forward, and hopefully treatment options will continue to increase and improve. But the bottom line is that whenever we have a student or a client who is going through cancer treatment or who has a history of cancer treatment, it's important to advocate for hearing screenings and refer to an audiologist as needed, especially because some chemotherapy drugs can also cause tinnitus. As we reflect on the many different ways that childhood cancer can impact communication and the ways that these impacts are addressed in speech therapy, it reminds me that no matter the setting or situation, there are some core elements of our work that are similar. But there are some elements that are particularly important when we are supporting children who are going through cancer treatment or who have been through cancer treatment, and one of those aspects is collaboration. Of course, collaboration is always important in our field, but with childhood cancer patients, it's especially vital. There are so many different professionals involved, and our ability to interact and share information with each other makes a huge difference in the quality of care a child receives. And since the audience for this episode is mostly school-based SLPs and private practice SLPs, I'll just acknowledge that it can be intimidating and overwhelming to collaborate with some medical professionals. If this is something that you've struggled with, please know that you're not alone, because these interactions can be really challenging and kind of push you outside of your comfort zone a bit. So my recommendation is to embrace our unique strengths and knowledge base. Our presence is valuable for so many reasons, and kids who are fighting cancer are often desperate for a sense of normalcy and worried about falling behind at school sometimes. And rightfully so, parents and other caregivers are going to be overwhelmed by trying to navigate the healthcare system and the special education system all at once. So I want to emphasize that when we help our students stay connected to school as they're going through cancer treatment, and when families advocate for appropriate accommodations, screenings, and services, we are doing important work that makes such a difference. I know that was a little soapbox moment there, but I really just feel strongly about this. We all have something valuable to offer. So with that being said, let's talk just a little bit about the educational impacts we might see as students return to school full-time after going through cancer treatment. One term that comes up a lot in the literature about cancer and educational impacts is late effects, which is pretty much exactly what it sounds like. The impact from treatments like chemotherapy, radiation, and surgery can last for many years after the treatment itself is finished. So that's just a reminder that many of the effects that we talked about earlier in this episode might continue even if the student has been done with treatment for quite a while. In particular, students might have problems with memory, processing speed, attention, and executive functioning, or they might experience cognitive fatigue. Those challenges could definitely cause a student to struggle academically. With that in mind, we can play an important role by making sure the IEP team understands the connection between cancer treatment and academic difficulties and making sure that the student has appropriate goals and accommodations. It's also important to be extra careful about avoiding duplication of services. We want to be sure that the student has the support they need in order to access their education, but we also need to be mindful of their fatigue levels and minimize transitions as much as possible during the school day. Ultimately, I think that childhood cancer is one of those topics where it's important for all of us to learn the basics. And then if we have a student on our caseload who is going through cancer treatment or has gone through cancer treatment, we can go deeper to learn more about their specific needs and challenges. I will put plenty of links and resources in the show notes for you just in case you want to get a head start on that. Like I mentioned earlier, this is also a topic. It's very heavy and very complex. So I just wanted to close with one last reminder that our work is vital and it makes such a difference, even when it doesn't always feel like it. We can help provide a sense of stability and safety as a child goes through a painful and disorienting experience, and that really does mean something. It also means a lot to me that you spent time listening to this episode and learning about this important topic. I appreciate all of you so much. If you enjoyed this podcast, please consider taking a moment to leave a review to help other SLPs find the show. And please don't forget to check out thedigitalslp.com/digitalslp if you're interested in exploring the membership and other resources on the site. Like I mentioned before, we offer a free 30-day trial, so that's a great way to learn more and try out some of our materials. Thanks again for listening.